Hi, everyone. So, I just want to take this opportunity today to address something that kind of bugs me in terms of the way we talk about mental health and neurodivergence in general. So, high functioning is a term that I brought up on the channel before that I don't really agree with. And so, I just want to kind of talk a little bit more about why that is, why it can be, harmful to different kinds of people and what maybe some alternatives are. So oftentimes people refer to me as high functioning because I present in a way that looks by all intents and purposes normal or neurotypical and that kind of thing, and I can pass as not necessarily having a mental illness such as schizophrenia. But this kind of does me and other people that we label high functioning a disservice. It kind of takes away the, ability to struggle in the open. It kind of puts this pressure on people we label high functioning to never show any symptoms, to never show that they are struggling. And that can be a lot of pressure, and it can be potentially harmful in terms of isolating the person and making them feel like they can't be honest about what they're experiencing, or they can't struggle at all because then, they wouldn't be as high functioning. And the other side of this coin is also true, where if we are calling people high functioning, then that's alluding to the fact that there are people who are low functioning, and that's not really a super nice way to refer to people or to think of people as being low functioning. Not to mention that it completely detracts from the valuable contributions that these people can and are making to the world. The reality is that mental illnesses affect everyone differently. And I think there is a spectrum amongst illnesses such as schizophrenia in terms of, maybe the severity of how someone experiences symptoms, or the frequency of how someone experiences symptoms, or even the types of symptoms that someone experiences can affect everyone differently. And so, it's no wonder that we're all going to experience mental illnesses such as schizophrenia in different ways. And this is going to affect a person's ability to function, or it will affect the way they are presenting to the world. And that's okay. Everyone's experiences with the illness are valid and really have no reflection on a person's functionality or on a person's contribution to society. And I feel like that's kind of where the icky factor in terms of labeling people high functioning comes into play, where you are kind of building this hierarchy within mental illnesses of who is more worthy within society, those who are more high functioning. And, that's problematic for a lot of different reasons. And so, I want to kind of offer up potentially an alternative when referring to people who present differently. So instead of using the term high functioning, perhaps you could use the term well presenting, because that's more accurately depicting the phenomena that you are trying to describe. The person is presenting in presenting wellness, presenting in a good way. And that's not taking away from the person's struggle, because, they may be internally struggling, but they are presenting well. And so using that more intentional language. And then that's also, a little bit easier on the people who maybe aren't as well presenting, that they are, presenting more that they are struggling, and that's okay too. It's less of like the high functioning, low functioning kind of gross language. So to sum up this video, please stop calling me high functioning, and I'm going to make a general statement. So please stop calling anyone high functioning, whether it's speaking about someone with schizophrenia or someone with depression or someone with anxiety, or even, someone on the neurodivergent spectrum, whether they have autism or ADHD. The term high functioning is problematic for all of these types of neurodivergence. And there are, better ways to communicate, such as someone is well presenting, instead of labeling them as high functioning, which again kind of decredits their struggles and their experiences of the illness, and also infers that there are people who are low functioning. That's not very nice. So I hope this video was helpful if you were looking for different language instead of using the term high functioning. If you'd like to see more videos from us, make sure to subscribe. And if you want to help support the creation of videos like this, make sure to check out the link to our Patreon page. Thank you for watching, and as always, wishing you and your loved ones good health. See you in the next video. Bye.